I want to thank you, Eric, for this kind introduction and also for organizing this series of talks, which seem very nice. Hopefully, I will see the other people that you talk to you. And yeah, and today I will talk a little bit, like explain how we conducted this randomized clinical trial with ayahuasca for treatment-resistant depression, and what we have found, the main findings, and also the mechanisms behind its action. So let's see. Yeah, so just for disclosures, this project was funded by Brazilian National Research Agencies. And to start, I want to talk about what is ayahuasca. So I don't know if everybody's familiar with, but ayahuasca is this psychedelic brew from Amazonia origin, and it means the vine of the souls in Quechua, which is a Amerindian language. But also, beside this Amazonian and very old traditional use, ayahuasca has also been used for some years now, since the 1930s, in some Brazilian religions, like Santo Daime, União do Vegetal, e Barquinha. So for these religions, consider ayahuasca as a sacrament. That's why Eric told you that ayahuasca in Brazil has a legal status. So for religious purpose, you can use ayahuasca. That's not the case for other kind of use. So you cannot use in a recreational way, for instance. Even though I think ayahuasca is not very like it's not very recreational substance, but yeah. So in that context, like in the rituals context, and also for the science, we can use ayahuasca. I should say, like, it's easier to study ayahuasca than use like psilocybin, for example. And ayahuasca is normally prepared as a combination of two plants. So it have the Psychotria viridis, the leaves of Psychotria viridis, with the bark of this liana called Banisteriopsis caapi. So it's the leaves of chacrona with the bark, which is jagubi or mariri. And that these two plants are put together in water and boiled for like hours, like 8 hours, 10 hours, yeah. And we normally call that a tea, even though it's not a tea. So it's this decoction. But what's the pharmacology behind ayahuasca? So with these two plants, we have on the one side, the leaves of Psychotria viridis are rich in N,N-dimethyltryptamine, and DMT. And DMT is a classic psychedelic because acts mostly as a serotonin agonist, acting in these 5-HT2 receptors. But one curious thing is that if someone takes DMT orally, it will be completely degraded by some enzymes you have in our gastrointestinal tract, this monoamine oxidase enzyme. So when you put together this DMT with the bark is rich in beta-carbolines, which are inhibitors of the monoamine oxidase. So that combination allows DMT to reach this, the nervous central system and to cause all the effects we know that are associated with this brew. So the phenomenology of the ayahuasca, it's like other psychedelics can cause a lot of different changes in the brain and how people feel about themselves. mostly achieved with eyes closed, but it can also happen with eyes open. But with the eyes closed, people normally describe seeing very vivid scenes, scenes geometric patterns or complex scenes as in a dream. And also they can have a lot of cognitive changes in thoughts, in mood, awareness, changes in the perception of space and time, and reality as um, a whole. And the time course of ayahuasca is normally, it takes like 30 minutes to 40 minutes to start having an effect after ingestion, and peaks around 1 hour 30, 2 hours, and subsides after 3 to 4 hours. And normally it's like that. Our group has been studying ayahuasca since 2006, and I work with a professor called Braulio Barros de Araújo, and he was first interested in studying the neural basis of this psychedelic effect. Particularly, the first paper he published was this one, seen with the eyes shut. So he was interested in investigating what was the neural correlates of this vision, of this mental imagery. So they conducted a study using fMRI, and they put people who were like very experienced in taking ayahuasca, so they were members of the Santo Daime Church, and they underwent two scans. Didn't I change for that? And they underwent two scans, one before and one 30 minutes after taking ayahuasca. So they were during the effects, they performed this better. Yeah. So during the effects, they performed this scan, this fMRI acquisition, and they were shown sometimes some pictures, or sometimes they just had to imagine those scenes. And what they found was that the activation in view 1, which is like this primary visual cortex area, which is normally activated when someone is really seeing something. So it's the primary input in our brain for vision stimuli. This region was activated almost as the same way for the imagery task. So when people had the eyes closed. Also, they show that there is a lot of regions involved. There's also this frontal areas and hippocampus. On the same data, or in the same subjects, we also acquired some resting state data, which is like people do not have to perform any task during the acquisition. They just lie down with the eyes closed, and we acquired this fMRI data. And with this data, we can use, investigate some resting state networks, which are like a series of brain regions that communicate to each other normally when we are doing nothing. So this was indeed my master's, and we investigate this default mode network. That's a set of regions that include this posterior cingulate cortex, medial prefrontal cortex, also some parietal regions. That and it's this activity of these regions are related to self-referential processes. To when someone is like thinking about the future, or planning the future, or thinking about the past, or also when someone's not engaged in the task. So like right now, you are listening to me, but at the same time, you can just mind wandering and think about another thing. So these regions are more activated during this process.
So what we see with psychedelics and what you saw with also with ayahuasca is that this activity of these regions are reduced during the psychedelic effect, during the ayahuasca effect. Also the connectivity, so also how these different regions communicate to each other is also, we have a reduction in connectivity during the psychedelic effect. We also use tools from physics to try to understand the psychedelic effect. So we also did this apply complex network paradigm to investigate how it was the entropy of the brain in the states promoted by ayahuasca. And we found that the channel entropy was also increased during the effects. I think both this default mode network and also this change in entropy is now like landmarks for the psychedelic effect. So it was shown for different substances, for LSD, from DMT alone, also for psilocybin. Yeah, so we did all these kind of neuroscience first studies, interested in know more about the psychedelic effect. But then we decided to move to investigate whether ayahuasca could have a therapeutic potential, and especially in depression. And why we did that? So first of all, we did that because when Drauli was conducted this trial with health volunteers, he received a lot of anecdotal reports of volunteers that told him that, oh, I used to be depressed, and then I start taking ayahuasca and I feel better. So a lot of people came to him to say that. Yeah. So, but okay, that's nice, but can be just a fact of being part of a religion or being part of a certain context. Yeah. But also some field studies, some naturalistic setting studies on epidemiology of people who drink ayahuasca as a sacrament also show that these people has some positive aspects, has positive symptoms or positive aspects in psychiatric symptoms, as also increased quality of life, decreased anxiety, decreased also depression. And after that, we decide to run the first clinical trial investigating so the ayahuasca as an antidepressant, but now at the hospital, so in a clinical context. This was the second paper published for our group, and it was an open label study. So as when someone is conducting a clinical trial, that's at some types of clinical trial you can conduct. One of them, the first one, I should say, is like these open label studies, which like that's no masking about the treatment. So everybody knows the substance that will be investigated, patients know, the scientists also know. And we had really good results from that study. Here you can see in the x-axis, we see the time. So from before dosing session, during dosing session, like 40 minutes, 80 minutes, and also 1 day, 7 days, and 14 days, and 21 days after the session. It was only one session with ayahuasca, and the patients were all having treatment-resistant depression. So patients that had tried at least 2 antidepressant medicines without being better. And in the y-axis, we can see 2 different questionnaires to assess depression severity. In blue, it's the Hamilton scale, and in red, the Madris scale. The bigger the values here, more severe is the depression. Yeah, so you can see it, all patients start at very depressive symptoms. And here we have the dosing, and we can see here 1 day, just 1 day after the dosing, these symptoms are much lower than at the beginning, and these results are maintained for 21 days. So this was like really promising results, but we also know that we can have some limitation on this kind of studies because you didn't control for the placebo effect. So the placebo effect is high, and it's especially high in depression or in psychiatric conditions. So that's why that's the motivation why we did the next step and conducted now this randomized control trial, include a placebo. So here I show this the scheme of the design of the trial. We had the participants, the patients, they spent 4 days with us doing measures. So they arrived at the baseline. So the first day, they did some psychiatric scales, neuropsychological tests. They underwent an MRI and fMRI scan, and they slept at the hospital doing an EEG. The next day, we collect saliva and blood samples, and we did perform some baseline psychiatric scales, and then they received either placebo or ayahuasca. At the end of the day, we applied some psychedelic questionnaires also to assess the psychedelic experience. And at the end of this day, they went home and they slept at home. The next day, they came back to the hospital and we did the same measurements again. Yeah. And 7 days later, we asked them to return to the hospital to do another assessment with the psychiatrists. So this was a parallel arm design trial, which says like a half of the participants took ayahuasca, half of the participants took placebo. We use a dose of ayahuasca which is similar that people are using in the rituals. Yeah, it's more or less like 1 milliliter per kilogram of ayahuasca placebo. So a person who has 70 kilos took 70 milligrams of mLs of ayahuasca. We also tried to do a placebo that had at least some effects of ayahuasca, not the psychoactive part of the effects, but that the effects that has with this gastrointestinal part of the effects. Yeah, so we put some zinc sulfate at the placebo. So it was a brownish color liquid with taste not very well. And also that provoke a little bit of nausea and some discomfort. Yeah. The participants, so we had 35 patients with treatment-resistant depression, but also include 50 health volunteers. Yeah, and they went under the same measurement. So 25 took placebo and 25 took ayahuasca. This was the room. So all the experiment took place at the University Hospital on Offer Lopes. It's the hospital from the university. And we have this room there, which is not like an hospital room. It's more like a bedroom. So the participants, they slept here at this bed, and the session happened here in this recliner. During all the time, they were also being having this cap this EEG cap. So we did an EEG during all the time. And me and Braulio mostly, for almost all the sessions, we would like sit just in a room aside, like not in the same room. We were like just looking to the participant, but not really interact to them unless they ask for help or for something. Yeah. Also, they were allowed to listen to music. We had a playlist, which is on our Spotify. If you want to, you can look for ayahuasca clinical trial, and it's there. And so they listen to music for 1 hour, then they remain in silence, and then they listen to music again. This was like this session. So what we found was like ayahuasca seems to have a rapid antidepressant effects, which begins already 1 day after the dosing session, and that remain significant until 7 days later. So here in red, you can see the ayahuasca group, and in blue, the placebo group. The first thing I want to show you is that, as we expected, we did have a placebo effect. Yeah, so you can see here in this line that the placebo group also improved from the depressive symptoms 1 day after. And they improved more on the second day, but then 7 days later, they start to feel the same that they were at the beginning. That's not happened for the ayahuasca group. So for the ayahuasca group, they improve more, and also they stay better for 1 week. Yeah. So this is very nice for mostly for 2 reasons. The first one is that those patients were treatment-resistant patients, so they had tried at least the mean, I think, of the treatments was like almost four treatments before being engaged enrolled in the trial. We had even patients that tried ECT, electroconvulsive therapy, and not getting better. And so I think this is the first main accomplishment of the trial. And the second one is the time when we see the first decrease in the symptoms, which is like really rapid compared to the antidepressants we have now at the pharmacy. Yeah, you know, like most of the antidepressant takes 2 weeks to start beginning the effects. Yeah, I think now we have ketamine, but at the time, I think this was not the case. We also did a secondary analysis on this data, looking only for this suicidality aspect of the patients, and we saw the same could observe the same thing here with the ayahuasca group. So yeah, people from within the ayahuasca group had this decrease in suicidality, which is occurs 1 day after, and also lasts for 7 days. And for the placebo, we didn't have like a real change here. This was a collaboration of Rick Zeifman from Canada. Well, so I think this is really nice and really impressive results. But we want to go further. We want to investigate now why that's happened, or how could be the potential mechanisms behind this underlying these antidepressant effects. So we first looked to these subjective effects that happen during the effects of ayahuasca, to see if that's some relationship between what is happening in the acute state and also related to these positive outcomes. We use this questionnaire, which is a hallucinogenic rating scale. It was a questionnaire developed by Rick Strassman when he did his trial on DMT. So it was designed for DMT. That's why we used. And it assessed the psychedelic effect in 6 scales. So we can see the intensity, the changes in somesthesia, in affect, in perception, in cognition, in volition. So again, in red, you can see the ayahuasca group, and we observed that there were significant changes in all the factors but affect. So affect was the only factor that did not change between placebo and ayahuasca. And also, we did some correlations, and we saw that people who respond to the treatment, the patients who respond to the treatment, were these changes in MADRS score. So the improvement was correlated to the changes in perception. So in this subscale perception, the volunteers, the patients who had more change in perception were those volunteers who improve more. Yeah. So again, this is like a small sample and it's just a correlation, but it seems to have something to look at that. So maybe this psychological change that happened during the effects has a role in the antidepressant effect. But also, we designed this trial in order to acquire a lot of, in order to be possible to investigate a lot of biomarkers. Like in the blood, we assessed hormones, we assessed a lot of molecules to see if there were changes in those molecules that are related to the antidepressant effect. So we observed a cortisol modulation. A cortisol is a hormone related to stress that is somehow changed by depression. It's in the literature you can find both patients with depression being having high levels of cortisol than normal controls, or also the contrary, also lower levels of cortisol. So hypocortisolemia or hypercortisolemia. And in our case, the patients had hypocortisolemia, and after the treatment, they had the same cortisol levels than the controls. That's why we include this control group in the sample also to compare in this case. We also looked to the BDNF, this brain-derived neurotrophic factor, which is related to plasticity, neuroplasticity, and also it seems to be somehow dysregulated by depression. And we saw an increase in BDNF after the treatment for the patients also. And we also investigated inflammatory biomarkers because depression sometimes is considered, or it could be considered as an inflammatory disease. So that changes in inflammatory biomarkers related to depression. And we assessed one of them, one biomarker called C-reactive protein, CRP. And we observed here at the beginning, before the treatment, patients had increased CRP levels compared to the control group. And when we looked 2 days after the treatment, patients from ayahuasca group had decreased levels of CRP compared to placebo. So again, these inflammatory biomarker levels were decreased 2 days after the treatment, and these decreased were correlated with the improvement in MADRS scale. Yeah. We also did some fMRI 1 day before and 24 hours after the treatment. And we were interested in evaluate this resting state network. So we chose the default mode network, which it's known to be affected by psychedelics, but also another network called salience network, which is also implicated in mood, emotion, and attention. In this paper, we just looked to the control group data, yeah, because for the patients, we had a small number of patients that didn't allow us to do a lot of statistical inference. But for the control group, what we see here is that an increase in salience network after the treatment, and a decrease in the fold mode network during after the treatment. So it's we can see that even in a subacute effect, like 24 hours after the effects, we still see some brain changes by fMRI. And we also correlated these changes with the acute effects again, using the same HRSS scale. And we observed that people who had more changes in affect were those who had more changes also in brain connectivity, particularly in this relationship between the full mode network and the salience network. This, besides this paper was did on controls. This is important because we know that both DMN and also salience plays a role in depression. So these networks are altered in patients also. So this could be a mechanism of action also, and help to explain the effects we saw. Well, I also want to bring the other side of the trial, which is like the limitations we have. First of all, the number of patients was modest. We start with 35 patients, but at the end we had 29, 14 in ayahuasca group and 15 in the placebo group. The study was limited to patients with treatment-resistant depression, which is a particular case of depression, and they had a high comorbid personality disorder. This is not always the case for the psychedelic clinical trials. Normally they avoid this kind of patient, but for us was like 70% of the sample had a personality disorder also. So we had to include them. It was not possible to do the contrary. And most of these patients had cluster B disorders like borderline or histrionic. And at least I think it's this double blindness issue that we have discussing a lot, I think, in the last years for psychedelics is really hard to do a real placebo-controlled double-blind study with psychedelic, because psychedelic is like has this very peculiar set of effects that's it's hard to blind. We did try, and I can comment after how we try to deal with this, but we have to be aware that's always a limitation. So to conclude, our trial suggests that ayahuasca has this rapid effect in depression, and that we are not sure about the mechanisms behind, but we have some clues on what maybe are playing a role in this effect. And we think that this neuroimmune, neuroendocrine, and also neuroplasticity pathway for homeostatic regulation, as well as the phenomenology of the acute effects, are important to achieve a positive outcome. This is my team. Braulio is the PI at the lab, and we had a lot of collaboration. So we had a team that is responsible for the biochemical part, also a lot of psychiatrists that helped us during the sessions and also evaluating the patients, and some collaborations, as I mentioned before, Ricky Zeifman and also Lorenzo Paschini, who contributed in this fMRI paper. So it's it. Thank you all, and I hope you have questions.